Hello, sixth graders. Welcome back. It is Monday the 27th, and this week we are going to start doing our research for our informational essays. Now, these are very similar to our persuasive essays. We're still going to follow the claim evidence analysis route. However, the difference is when you're persuading someone, you're trying to convince them whatever your point is. When it's informational, you're just trying to inform them on the topic. This week will mostly be research. We aren't going to be doing much writing. We're just simply searching for evidence. So I'm going to click on Informative Essay Slideshow. You're going to have to click up here. Now, I'm going to switch my tab. All right. So an informational essay has a specific writing process. What it is it educates your reader on a topic. They can have one or several functions to define a term, compare and contrast something, analyze data, or provide a how-to. What they do not do is present an opinion to persuade the reader. That would be a persuasive essay. The author of an informational essay becomes a teacher that informs the reader about a topic or a process. So informative essays really just are there to help explain something, tell something, or give directions. For example, if you wrote about your favorite aunt, you would be writing an informative/expository essay telling us something about your aunt. Likewise, if you wrote an essay that gave directions for making a paper airplane, you would also be writing an informative expository essay that gives directions. So how do I do this? Because you are informing a reader about a subject at the most basic level, you must have structure to write to ensure to make sense. To make sure it makes sense. Ironic, that didn't make sense. Anyways, it is best to break apart the writing act into a process that makes the job easier for you and more logical for your audience. So, we have a specific process we're going to be doing in my class. So we're going to be doing research, we're going to be brainstorming, we're going to have a discussion board. I have a graphic organizer for you guys. We're going to talk to each other. And then obviously we already know the audience. It's your teacher and your classmates. And the purpose of it is so you can pass sixth grade. Just kidding. So then we need a rough draft. We're going to put things together, but we'll get more into that later. We're going to revise, and then we're going to proofread. And then finally, we're going to submit it. So we'll get more into detail about what the steps are. Today, I just want you to understand what an informational essay really is. I'm going to switch my tab back to Schoology. Our goal for the day is going to be to go to this Lasik eye surgery informative essay. So there's an essay here called Lasik eye surgery. It is pretty long. It is an informational essay. So I'm going to go ahead and read this to you. And then your job for today will be just to go back and highlight the claim in this color, a lighter pinkish purple, your evidence in light blue, and your analysis in yellow. And then I've also written what claim evidence analysis means for those of you who forgot. All right. The days of family vacations with my mom, dad, and sister came to an end in the summer of 2004. Now both my sister and I have our own families. This particular trip was one to remember. It involved one moment that can never be recaptured. On one afternoon, the four of us decided to drive the famous Route 1 south of San Francisco. We stopped to walk the beach, and that's when it happened. The crashing waves forced my mom from the shoreline, but her sandals got caught in the wet sand. She fell backwards, causing her collected shells to spew along the beach. This was Mom's most embarrassing moment, but the mist from the ocean had fogged up my glasses. I missed it, but most people have less than perfect vision, so what could I have done? Contacts could work, but they can be annoying and scratchy. LASIK eye surgery is an effective alternative to glasses and contacts. But what is LASIK? How much does it cost? What are the procedures and the recovery like? They're all good questions anyone should ask themselves before investing in LASIK eye surgery. Hint, hint, what is our topic? LASIK eye surgery. What are we going to be informed on? The first thing anyone interested in LASIK surgery should find out is what it is. The purpose of the surgery is to help resurface the cornea. Over time, this part of the lens sags, causing unfocused vision. Surgery helps reshape the lens, making vision clear. According to the International Society of Refractive Surgery, it has actually been around since the early 1900s. It wasn't until the 1970s that doctors invested more energy in implementing it. An accident in 1978 in which a kaleidoscope broke, sending elements to a gentleman's eye, gave doctors more insight into dealing with the corrective surgery. After months of scraping out the elements, doctors and the patient were astonished that the eye was healing the wounds and better vision was apparent. A few years later, doctors began experiments using lasers to make incisions on the eye. It wasn't until 1998 that the FDA, Food and Drug Administration, approved LASIK eye surgery. Just a heads up, there's tons of evidence and analysis in that already. Understanding the surgery is one thing, but with any elective surgery, there is a price. Glasses can cost anywhere between $100 and $200. This cost is due to yearly checkups and the glasses. Replacements are equally expensive, and most people that have glasses will also want prescribed sunglasses. Contacts can cost just as much, if not more. In some instances, they can cost between $300 and $500. This depends on whether the contacts are permanent or disposable. According to WebMD, there are two types of LASIK eye surgeries and each cost a little different. Just a heads up, if you haven't caught on yet, anytime there's something that says according to, or it brings in another outside source, that is your evidence. You want to highlight that in yellow. Continuing, the use of blades to make the incisions is a practice not used much today because there is a greater chance for infection and it takes longer to heal. This process costs around $1,000 to $2,000 per eye. The more up-to-date form of LASIK uses lasers, this practice creates a more precise incision, and the heal time is substantially less than using a blade. The lens is not torn with this process. Because of these added bonuses, the cost is $1,500 to $2,500 per eye. If a patient knows the cost, he or she can then begin the procedure of having the surgery done. Before the operation can begin, patients must have several consultation meetings with their surgeon in order to find out if they are a good candidate. The pupil will need to be measured, the contour of the eye examined, and the dryness of the eye will be determined before proceeding. On the day of the surgery, patients will need to bring a driver because they will not be able to see clearly afterwards. Once in the doctor's office, a regimen of eye-numbing drops will be administered according to the FDA. This typically takes 20 minutes. After the drop has taken effect, the patient is escorted to the surgery room, which is extremely sterile. The suction type apparatus is placed on the eye so that the patient will not be able to close them. Vision turns completely gray except for two laser lights, one green and one red. The first laser creates a U-shaped incision on the cornea, making a flap. The flap is brushed aside, and the second laser reshapes the stroma portion of the cornea. This corrects the vision issues. The reshaping process only takes about 5 minutes to complete. The next step is the recovery. The patient's eye will water uncontrollably. This is due to the numbing drops. They may itch and sting, and halos and sensitivity to the light will most likely occur. Dry eyes will become an issue as well, even though the patient's eyes are watering. Some people require painkillers afterwards, like Vicodin, or for lesser pain, aspirin. The patient's vision should be almost 20/20 immediately after the surgery. According to WebMD, during the first few weeks, restorative eye drops will be needed. Refreshed teardrops will be needed for roughly 6 months, while a healing eye drop will be needed for 3 weeks. The first week will also require a drop at night that helps seal and protect the eye overnight. The patient will also need to schedule checkups in order to make sure they are experiencing 20/20 vision. While the surgery is permanent, nothing lasts forever, especially when dealing with the human body. Regardless, LASIK should last for quite a long time. Having gone through wearing both glasses and contacts, I know the discomfort associated with them. After doing the research on LASIK, I found out my options for vision correction meant bladeless surgery. Because I followed the proper procedures with eye drops and medication, I now have 20/20 vision. As we will all have eye issues in our lifetime, it is important to know that the alternatives to contacts and glasses. The ultimate goal is to ensure that my vision will last and I won't miss those special moments like the time along Route 1 where I missed my mom's moment. Alrighty, so your goal today again is just to highlight the claim, evidence analysis in these colors. Good luck, and I'll see you tomorrow. Bye-bye, 6th graders.